We're pleased to be joined by Dr. Steven Sheris, Executive Vice President and Chief Physician Executive of Atlantic Health System and President of Atlantic Medical Group. Good to see you, Doctor.
Thanks for having me, Steve.
I'm curious about something. We've asked a whole range of healthcare and physician leaders about the most significant pivot that they've made as it relates to COVID. What would you say yours has been?
Well, I think for a lot of leaders who are used to managing every detail of healthcare because it's necessary to assure good outcomes and safety, COVID has required us to really trust our teams and let them operate with maturity, experience, and agility in an environment that is constantly changing. So you have to give up a lot of control in order to succeed.
The other thing that's interesting, and I'm fascinated by communication, and to disclose, to communicate clearly, Atlantic Health is one of the underwriters of what we do. But I'm going to ask you this, from a communication point of view, if telehealth is here to stay, if telehealth is going to be such an important part of our life, does it make the ability and the need for physicians to be even more effective communicators, not in person, A, and B, how the heck is that being taught?
Right. We knew right from the onset of the pandemic, when telehealth became really the only way we could safely remain connected with our patients, that we had to develop a different communication style. And not only did we build the telehealth platform and stand it up within 3 days way back in March of 2020, but we simultaneously embarked upon a communication strategy. The web presence, how you remain connected, how you maintain the relationship that you have developed with your patients over the years in the exam room, but through the barrier of telehealth. And I think the patients really appreciated that. I think it remained a personal experience.
You know, there's so much convenience involved, but a personal anecdote, which I know is going to be shared by a lot of others, that's the only reason I share or disclose, is there's a dermatologist who's absolutely great. And I sent her a picture. I said, hey, take a look at this, doctor. And she goes, well, I can't tell from the picture. You have to come in. And I came in and she did what she needed to do. But I realized that while telehealth is incredibly useful, there are limitations. And we need to realize that it can't all be done, nor should it all be done that way, but it does have a place. Is that a fair assessment?
Absolutely. It's one of many ways to deliver care. It will not supplant in-person care. Often it will be necessary to lay hands on the patient or see something in person to get the full clinical picture. But what it does for us is it enables our ability to remain connected with our patients and actually reach out more frequently, less expensively,
That's right.
and in a real connected way to ensure health and wellness, and also take care of patients when they're mildly ill.
Doctor, you and your colleagues are very committed to helping those who are long haulers from COVID. Exactly what's going on?
We had, in October, stood up our Atlantic COVID Recovery Center, headed by Drs. Fred Cerrone and David Souza. And pretty quickly, we were seeing 12 to 15 new patients a week, taking care of a total of 650 patients to this date, with a varying array of symptoms, anything from the usual brain fog that you might read about, to neurologic symptoms, to cardiopulmonary symptoms, to fatigue. Patients actually felt lost, like there was no hope. And for us standing up this center, it gave them one place, one-stop shopping, one coordinator, one navigator where they could get help and begin to direct their care as appropriate.
Do you mind if I shift gears to talk about leadership in this sense? You have a connection and a relationship with former head of the Joint Chiefs of Staff, General Colin Powell, correct?
Yeah, it was a fleeting relationship because I got to participate in the care of his chief of staff when I was in the Navy about 30 years ago, when I was a cardiology fellow at Bethesda Naval Hospital.
Can I ask you a specific question?
Sure.
In studying General Powell and his leadership style, one of the things that always struck me is that not only was he tough and strong and made tough decisions, and he said to me one time in an interview, sometimes people get peeved at you for making tough decisions or giving them feedback they don't want to hear. The other side of him is a very important, empathetic and compassionate and caring part that you shared with some of our producers and you talked about publicly. Please share.
Well, yeah, after that incident where we took care of his chief of staff in the cardiac cath lab during a heart attack, what struck me, and I was, in my 30s at that point, is General Powell then reached out to the entire care team, and not just to the doctors, to the cardiologists, but to the techs, to the secretaries, to the nurses. Each and every person got a personalized photograph from General Powell saying thank you. And to me, that's the greatest sign of a leader, when he deflects credit to his teammates for successes, when he remembers that a small word of kindness can leave a lasting effect. And so that always stuck with me. And a year and a half ago, when our CEO, Brian Granulotti, whom you know, was the chair of the American Hospital Association, invited me to an event where General Powell had spoken. And I related that story to the General, and I just said, General, I want to thank you for saying thank you. So in some way, my career came full circle, because it taught me a lot about the effect of words and leadership and trust, and imbuing that trust in your team enables those people to achieve great successes.
Yeah. Finally, before I let you go, saying thank you to frontline healthcare workers a year and a half into this pandemic. How important?
Well, the thanks has been overwhelming from our community members. That's who we serve. Right from day one, the outpouring of support that we got at Atlantic Health System was a never-ending well of resilience for us. And we could not have achieved what we did without the thanks of our community. So it was returned back to us immeasurably. And I want to say again, thank you to everybody who has supported the healthcare workers through this pandemic.
And we in the media want to say thank you as well, and say thank you to you, Doctor, for joining us. We appreciate it.
Thank you, Steve.
I'm Steve Adubato. We thank you, our audience, for watching. And let's make sure we see each other next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, TD Bank, ADP, the Fidelco Group, the New Jersey Board of Public Utilities Clean Energy Program, Johnson & Johnson, Fedway Associates, Inc., MD Advantage Insurance Company, and by the Adler Aphasia Center. Promotional support provided by ROINJ and by NJ.com.
Hi, I'm Governor Tom Kean. A dear friend of mine had aphasia, which is a language disorder that occurs from a brain injury or a stroke. It robs a person's ability to communicate, but it doesn't affect their intellect. Programs and services offered at the Adler Aphasia Center help to improve my friend's communication skills, as well as her self-confidence and quality of life. Most importantly, she was among people who understood her. If you or a loved one has been diagnosed with aphasia, there is hope.